This is a short presentation for all healthcare professionals for a mentor update for 2017. Please watch and listen to this before undertaking the mentor quiz. If you are unsuccessful at the mentor quiz, please read the feedback to assist you in re-attempting the quiz. In terms of supporting students in clinical practice, you as placement providers provide the ideal learning environment for students. We audit that and we have a contractual agreement. We have a contractual agreement as placement providers with our local education and training board, and also the Higher Education Institute, the university, has a workplace agreement with the placement provider, and between the local education training board and the university there's a contract. So there's a triangulation in terms of the placement provider, the supplier of students, and an overarching quality assurance to the local education and training board, who provide the finance for student placements. So you're likely to be in a locality host, so that could be a trust or it could be a GP practice, for example, and the idea is you strive to provide quality placement students working with the university to combine efforts in order to improve the quality of the students' learning experience. So what host providers provide is a suitable placement for each stage of the student's programme, or you may particularly have students in your clinical area that are a specific year because that's what suits the nature of their programme. And the other thing, the local host provider provides opportunities for employment and qualifying, and your employing organisation is considering and thinking and working towards attracting students to become part of their workforce. So to support learning, we have placement development teams, providing that link between the university and placement providers, both in NHS trusts and private sector. We work together to collaborate into a professional approach to support and enhance learning and practice. So each placement provider and a private sector has an academic and a practice lead. If you're in a large organisation or a large trust, your practice lead is usually one of the people working in your learning development or education departments. Each academic, each tutor is attached to a team, and they also support their own personal students as part of placement development team activity. Collaboratively work together to negotiate and develop quality placement opportunities. So, as I said, each locality has a lead. Each locality has a team to provide preparation for mentors, courses and mentor updates. The idea is to support all students and mentors within their linker area. Personal tutors, as I mentioned earlier, may also support their students in your organisation. The practice lead, as I said, probably your educational lead or your education link or practice educator within your organisation. They are responsible for allocating students in conjunction with the university and our allocations team, and they also provide mentor support, and we work collaboratively together around all of those areas. What we specifically do is, if there's a new placement area, we visit and we work with you to set that up. If anybody's new mentor, then we also offer our support there to help them get into the swing of mentoring, and certainly while they're doing the mentoring course we will support them there. If students are struggling, we'll come and support the staff in the area. If students have significant disability assessment requirements, we will come and meet with you, often pre-placement, to discuss with you their needs. If a student feels that things aren't going right for them and they ask for a visit, or if you request a placement visit because you're concerned about the student. We play a part in ongoing quality monitoring and auditing. We have to report to the Nursing Midwifery Council or the Healthcare Profession Council about the quality of our placements on annual. And also if the professional bodies are reviewing programmes, then they will visit, and also we provide support for CQC visits in relation to placement learning, and the CQC will 99% of the time when they come to look at an area, we'll speak to the students on placement in that area to triangulate their explorations of quality patient experience. So it's important for you to find out who your PD team lead is, your practice lead and your academic lead, know how to contact them. Their information is on our placement information site, but it's important you know how to get hold of people when you need to. So our placement information site, our Plymouth Online Practice Placement Information site, majority of you will know about this, and if you're watching this it's because you've gone into the site, and there's a whole wealth of things there. So let's have a look. So here you can explore the things that are important to you. The purpose is placement environment information. That's about your specific area. Placements on the web is where students find out about their placement, about you, the information that you've put there for them, and about their allocations. Your PET provides information to you also about the students that are coming to you, the times that they're with you, the times that they may have study, etc. Information about education audits and mentorship, and also all the policies that are relating to student placements can also be found there. And so when you go in, you have a whole range of buttons you can click on to look for. We're doing some reconfiguring and redesigning at the moment, but essentially all those information's there. Please go in and have a good look and have a good look around. So the Mentor Centre is there. You can go to the main site and click on the Mentor Centre, and that's going to take you to everything you would need to know. So what do our professional bodies expect? Well, there's an expectation they're equipped to mentor and assess, maintaining patient safety. You are the gatekeepers to the profession and ensuring that patient safety is maintained and those that actually qualify are fit for qualification. The NMC has introduced a framework for progression of mentor to sign-off mentor, practice teacher and teacher, and the healthcare professions, HCPC, have guidance for education standards. So these roles that have introduced increase the quality of student support, and also has increased the number of student referrals in practice since these roles were introduced in 2008 to make sure that things are right and things are done right by the student, essentially for patient safety. So what are the responsibilities? Planning the student's experience, assessment, and also every practitioner a student works with is responsible for contributing to the assessment and to their ultimate registration. And therefore everyone is responsible for ensuring patient safety in terms of student activity and quality of care, and ensuring that people are fit for registration. Students must complete a minimum of 150 hours before they can be assessed, and their length of their placements are varied. Sometimes they're on a short placement area where they have some objectives, others where they will be assessed as part of their assessment process. So, planning placement experience. There's a whole range of things you can do, and as mentors you're thinking about what stage the student's at, what their assessment requirements are, what resources you have within your team and in your clinical area to support their learning, and what their specific objectives need to be, what shifts they may be working, when do you need to plan their assessment, and should I ask them to come and visit us before and meet us and discuss their learning needs, and that is good practice to do so. And the students are thinking similar things. What service is provided? What do I know about the area? What do I know about the patients or clients that are looked after? What are my objectives, and what specific objectives can I achieve? What time frames do I need to work towards? And they are also thinking, should I visit? And those things are important. So here's a bit of a guide for you, the sort of things that you can think about doing. When you start, you orientate them, you introduce them to the team, to the clinical environment, and they're allocated a mentor or an educator, and maybe someone to also work with you as their main assessor, so a co-mentor. looking at their expectations in the initial interview, planning their experience, also identifying whether they've got exams or OSCEs that they need to do, so that they need to think about those things and how they can weave those into their objectives. There's a whole range of resources that you can use, and as you can see looking at these, there's all sorts of bits and pieces. Handbooks, welcome packs, their assessment documentation and all those kind of things. So as things progress, you've got to think about making sure their development plan is well planned, as it were, and you've agreed that you look at the assessment process and you start thinking about formative assessment, talking to their co-mentors in the team, giving the student feedback, and gaining an overview of how they're doing and how they're working towards their objectives. So the intermediate or formative assessment then, it provides them a review of their progress, and specifically areas of concern are identified and plans can be made to improve that. And this is really important for forward planning. A lot of formative assessment students pre-assess themselves, they do some self-assessment and ready for their discussion and think about their forward thinking and goals and where they may not be doing so well at and what they need to do. So their assessment documentation really is their key thing that you need. So it's review it and set the date for the final assessment, or if you feel that they need further formative assessments, then you set that as well. So monitor their progress, giving them feedback, looking at their assessments. If they're not on target or there are issues, please involve the team and the university link, your placement development team link or the education link, to raise concerns or issues. You don't have to wait until 6 weeks in. But you know, as things progress, if things aren't developing well, then you need to let us know so that we can help you with some remedial activities. So preparing for the final assessment, gathering your information from others to ensure you've got a clear picture of their progress and their development. You work with them yourself, you're looking at their evidence they're presenting, you're verifying that they've achieved what they need to achieve, or if they've not, please state in writing and also make it very clear, and also think about recommendations for how they can move forward following the assessment, whether they've been successful or unsuccessful. Students need to make sure that all their evidence is available, and they need to ensure that all the assessments are completed to the time that they have to do so. That is their responsibility, and so their documentation is complete and everything is there. As I said, suggested plan for how to build on and develop in the next placement area is really useful. And for yourselves, you need to have a personal record of your mentoring or co-mentoring to record in your training review or CPD file, so that you can ensure that you're up to date for registration purposes. So things don't always go right, and I've talked about making good plans and giving really good feedback. You do require courage and confidence if you are referring, and we want to support you, and it's really important for us to help you in making the correct decisions, and also ensuring that the students clearly understand why you may be referring them. It's important, extremely important, and you know, if things aren't going well, seek early support so that plans can be put in so the student can work to improve, to demonstrate what they've required to do. Everything is really important. Don't forget to set short-term objectives for them to develop, and arrange, make sure that you've got some really good feedback going on so that they understand where they are and what they've got to do. That was a short presentation there, so you may choose to go on into the quiz now, but we do have additional information for nurses and for midwives, and if you're a nurse or a midwife, please move on to the next presentation. Thank you for listening.